Experts say it may take months before the COVID-19 vaccine reaches an important population, kids. Some doctors worry it may already be too late to get a vaccine authorized for kids before the start of the next school year.
Our ABC 10 News anchor Derek Stahl is going in depth to explain the challenges surrounding kids and the vaccine.
We know COVID-19 hits older adults the hardest, but experts say the only way to control the pandemic will be to vaccinate children, who make up about 12% of the infections in the U.S. The problem is that vaccine makers like Pfizer and Moderna haven't even started testing their candidates in kids under 12.
Kids' immune systems are really different than adults. As any pediatrician will tell you, that kids are not just small adults. Their immune systems behave really differently.
Dr. Christian Ramers of Family Health Centers of San Diego says testing is needed to find the right vaccine dose for kids and see if there are any unexpected side effects. But the logistics are tough. Vaccine makers have to separate their trials into several age groups because children's immune systems change as they grow. And that means more child volunteers are needed.
I mean, it's more challenging as an investigator myself for research to enroll a kid into a study because you have to get permission.
Because parents have to sign off, experts say it can take much longer to enroll enough kids for a study. In October, Pfizer gave its vaccine to 100 kids ages 12 to 15. Moderna is expected to start testing in that age group in January. But neither company has announced plans for kids under 12. As a result, Dr. Evan Anderson at the Emory University School of Medicine told me our children under 12 years of age are almost certainly going into next school year without a vaccine option available for them. He says that could put school reopenings in jeopardy, impacting kids' mental health. And he says the vaccine may not even be ready for older kids in time unless more studies begin immediately or the FDA makes a decision based on the limited data it already has. UC San Francisco Dr. Peter Chin-Hong says that's a distinct possibility.
The bar will probably be lower in terms of seeing very robust data, but I know people will be watching that data very closely to make sure that the safety issues are also hold up for kids as they do for adults.
The American Academy of Pediatrics has been calling on vaccine makers to start including children in clinical trials since September. Without kids vaccinated, the group says we won't reach herd immunity, writing, "We know that children can be infected with COVID-19 and can transmit it to others." In a statement, Pfizer told ABC 10 News it is working actively with regulators on a potential pediatric study plan, but the company did not provide details. Derek Stahl, ABC 10 News.
And once the vaccine is approved for kids, a lot of parents are wondering if it will become a requirement for schools. Now, the California Department of Public Health told ABC 10 News several things would need to be in place before it would consider making a vaccine mandatory at schools or daycares. The vaccine would need to be reviewed and approved by the FDA and the Federal Advisory Committee on Immunization Practices. The American Academy of Pediatrics would have to recommend it, and there would need to be enough vaccine supply to enable access for all children.